We're going to, yes, we're going to have more and more speakers wanting to be at the symposium, yeah, because of this gong. So are we okay, Paul? Good. Everyone take their seats, please. Tiffany's just handing out your certificate of attendance. Tiffany's handing out your certificate of attendance. And I'd like to remind you to fill out the forms that are going around that will indicate your CE accreditation being mailed to you. This is going to be mailed around. Make sure your designation is correct in your name, and both parts of your name are correct, and your signature needs to be on this in order to receive CME from this great university called Westbrook University. If you haven't heard of it, it's because it doesn't really matter where your accreditation is coming from. I thought she said, what did I think you said? Anyway, Less Work University. So for our last presentation of this seminar, Dr. Ron had invited Dr. Marco Ruggiero here from University of Firenze in Italy. So we're really pleased to have him come this distance and to brave the icy Wichita afternoon coming from, well, Tuscany isn't that warm right now, but it's a hell of a lot warmer than this. So please welcome Marco Ruggiero.
Well, first of all, please let me thank the organizers, Dr. Ron in particular, and Mrs. Tiffany, and all the organizers and all the audience for being here. And I'm really honored to talk at this symposium, and I'm also honored to be the last one, since I learned a lot, and maybe some of my slides will be a repetition of something that has already been told. So the title of my talk is Food-Based Macrophage Activating Factor. Can it help cancer patients? And as you can read, the answer is yes, it can. So we could stop it here, but we still have some time. So please, let me try to explain you why and how it can really help cancer patients. What are macrophages? I guess you all know that these cells, big eaters, you know what they are. They are in a complex web of signaling in the immune system, and they function both in the non-specific defense, that is also called innate immunity, as well as in the specific defense mechanism, adaptive immunity. They direct most of the other cells of the immune system. And just like any cell, they receive signals from the outside, and they are activated by one protein, one factor, which is called GC protein-derived macrophage activating factor, or to make it short, GcMAF. Why GcMAF? What does GC stand for? Well, the GC protein was known also as vitamin D binding protein. It belongs to the so-called vitamin D axis. GC stands for group-specific component, and it is a big protein with several functions. It is long, 458 amino acids, and it has 3 domains, the first of which contains the vitamin D binding site. You can see in the upper part, this is domain 1. It is of little interest to us. Much more interesting is this amino acid in position 420. It is a threonine because it is glycosylated. There are sugars attached to it. And this is the precursor of GcMAF because during inflammation, during immune responses, this threonine is deglycosylated. The sugars are removed by some enzymes, and the precursor, the GC protein, which is not the activator, is transformed into the activator of macrophages, or GcMAF. That is also one of the most powerful activators of the entire immune system discovered so far. Now, the point is that the biochemical events that occur in vivo during inflammation and immune responses can be reproduced in vitro, and our hypothesis is that they also occur during the fermentation of milk. So we have different processes. I don't think you can see anything here, but don't worry about this. This is boring biochemistry. The point is that the same enzymes that activate the GC protein and transform it into the GcMAF can be used in the laboratory, and probably the same enzymes work during the fermentation of milk. Why? Why are we interested in this factor? The reason why is that there is one big problem with macrophages, and therefore with the entire immune system, and eventually with the entire body. The problem is that in many chronic conditions, and cancer is probably the first and most important of these chronic conditions, but not the only one. Chronic conditions like chronic infections, like HIV infection, or chronic fatigue syndrome, or autism, many other diseases, there is an elevated activity of one enzyme that has a very difficult name. We will see it in the next slide, that, to be simple, destroys the precursor of GcMAF. This enzyme, that it is called alpha-N-acetylgalactosaminidase, too long and complicated, so it has been abbreviated into Nagalase. This enzyme does not touch, does not interfere with GcMAF, but it destroys its precursor. So in many chronic conditions, there is an elevated plasma level of Nagalase, and because of this, the body cannot produce enough GcMAF. And because of this, you have either relative or absolute immune deficiency. Up to the point that Nagalase is being considered as a marker, not only a tumor marker, but also a marker for a number of other diseases, because it has been demonstrated that there is a correlation between the level of Nagalase and several prognostic indices during radiation therapy, surgical resection of tumors, or also in the experimental animal in therapy of mice that bear tumors. Not only that, the Nagalase level has been associated as a marker of progression in a number of other chronic diseases that have something in common, that is chronic inflammation, such as autism or chronic fatigue syndrome. This paper was published in 2009 by an Italian group, and here they demonstrated, among many other papers, this is one of some friend of ours, but there are many other papers in the literature, and these authors demonstrated that there is a correlation between the level of Nagalase and the stage of melanomas. However, the important point is that Professor Yamamoto, who is one of the fathers of GcMAF, one of the scientists, he worked in Philadelphia, now he retired. Professor Yamamoto began to work on GcMAF about 20 years ago and produced some of the most notable papers on the subject. He demonstrated that Nagalase cannot degrade exogenously administered GcMAF. If you wish, we could go into the biochemical details why, and again, it is very boring as all biochemistry, but there is a very chemical explanation as to why Nagalase does not destroy the GcMAF that you can administer from the outside, whereas it destroys its precursor in the body. Therefore, this being the case, there is a solid scientific rationale to treat all those conditions where Nagalase is elevated and therefore endogenous, natural GcMAF is low, just like cancer and other chronic diseases, with exogenous GcMAF. And in this context, GcMAF treatment could be considered like a replacement therapy, just like insulin when you don't have it, or thyroid hormone when thyroid has been removed, or vitamins when they are low. So when the body is unable to produce some important factor, in this case an important immunogenic activator, it can be replaced. Therefore, GcMAF treatment can be considered like a replacement therapy. Let's talk about GcMAF and cancer, since we are here at the Cancer Symposium. It is not something new. So far, I'm presenting all the data. In a short while, I shall present our most newest data. So the first observation of an anti-tumor effect in mice was published by Professor Yamamoto and collaborators in Cancer Research, so a prestigious journal, in 1997. And at that time, this was called immunotherapy of cancer. That is, to stimulate the immune system so that the immune system, once stimulated, could take care of the cancer. If you look at the US National Library of Medicine, you search for the PubMed, you will see there are about 43, 44 papers on GcMAF, and about half of them deal with GcMAF and tumor. By the way, 2 of the most recent papers published and referenced in the PubMed are from our research group, as you can see here. But of course, we are not the only one who published on this issue. And GcMAF has been experimented in a variety of human and experimental tumors. I will show you our data later on, but these data are so impressive that I cannot but show them. These data come from a Japanese group that has nothing to do with Professor Yamamoto, and I'm sure you will recognize one of the most prestigious scientific institutions in Japan, the Atomic Bomb Institute of Nagasaki. They have a particular interest, of course, in cancer. So what did these scientists do? They implanted human hepatocarcinoma cells, human liver cancer cells, in receptive mice, and let the tumor grow up to 100 cubic millimeters, which is a considerable size for a mouse. Then the mice were divided into groups, 10 mice per group, and the treatment group received 40 nanograms per kilogram of GcMAF in saline solution subcutaneously. So we are talking about a non-invasive treatment, subcutaneous, not intratumor, not intravenous, for only 3 weeks, 21 days. Well, I let you judge by yourself. On top, you see the non-treatment group, and on the bottom, you see the size of the tumors in the treatment group after only 3 weeks of daily subcutaneous injection of GcMAF. In terms of number, of course, they measured everything. The reduction is more than 90% in only 3 weeks. So this is really very impressive. We've been working on GcMAF now for about 3 years, and according to our latest results, the effects of GcMAF are not due only to the stimulation of the immune system and the immune system taking care of the tumor, but GcMAF, being a protein with multiple effects, like a Swiss Army knife, like a p53 protein, many proteins, they have multiple effects, has a multiplicity of actions that occur inside the tumor and in the immune system and involve both malignant and normal cells. Now, the slides that I will show you will deal with human breast cancer cells. Why human breast cancer cells? The cell line that we use is called MCF7. Well, because, first of all, human breast cancer is probably the most diffuse cancer in mankind, but also because it had been demonstrated in 2008 that GcMAF eradicated breast cancer in women. So this is the original paper. It says eradication of the tumors and no recurrence for more than 4 years. So we were very much interested in looking at what was happening at the human breast cancer cells. We obtained some results, and some preliminary results were accepted for presentation last year at the World AIDS Conference in Rome in July 2011. Here we demonstrated that GcMAF inhibited the angiogenesis induced by the tumor. We heard just a few minutes ago that vitamin C also could affect angiogenesis, and how important is neoangiogenesis or angiogenesis in the growth and progression of tumors. And also we demonstrated that GcMAF has a direct inhibitory effect on cancer cell proliferation, migration, and metastatic potential. In other words, GcMAF induces a reversion of the malignant phenotype. Cancer cells become normal. Of course, you should not believe my words, because the first commandment of the scientist is never believe what people are saying, but look at the results, look at the data. And I will not show you graphs or histograms, but pictures taken at the microscope. So these are human breast cancer cells growing in clusters. You don't see any contact inhibition, as they're not supposed to do, because these are fully malignant cancer cells. You treat the cells for 72 hours with GcMAF. After 72 hours, this is the way they look. They grow in monolayer. They don't climb one on top of the other. You don't see any clusters. The cells were regular, polygonal, uniform in morphology and size, just like epithelial cells are supposed to be. This is almost the same picture as before, but this is with another type of staining. Professor Pacini, who is here in the audience, is the one who does the staining, since she is an anatomist, so they are very well versed with staining cells. So this is Papa Nicolau staining, and you see more or less the same picture. These are clusters of neoplastic cells growing one on top of the other. These empty spaces indicate that the cells have lost their ability to attach to the substrate, and so they have the potential to migrate and give metastasis. And here you see, after only 72 hours, the cells are smaller, polygonal, only one nucleus in each cell. They look very, very normal. In addition to this effect on direct effect on tumor cells, we demonstrated that GcMAF also inhibited the angiogenesis that, as you know, is the supply of blood and oxygen nutrients to the tumor. As an experimental model, we used the chick embryo coronal tonic membrane. Essentially, you implant a sponge, and you implant the tumor cells in the sponge. The tumor cells, they produce angiogenic factors like VEGF and many other, and they attract the blood vessels toward the tumor. You can do this with and without GcMAF. This has been recently published. The asterisks here on the left indicate the number of newly formed blood vessels that infiltrate the sponge containing the breast cancer cells. And so you can count these vessels, and here you can see after 72 hours treatment with GcMAF that the number of blood vessels surrounding the sponges and infiltrating the sponges is significantly lower. And inhibition of tumor angiogenesis, of course, has a profound meaning, because it deprives cancer cells of their energy blood supply and redirects energy blood supply to normal tissues that is fighting cancer cells. And on the other side of the coin, starved and weakened cancer cells become easy prey of the macrophages that have been activated, become tumoricidal. They kill the tumor and have been activated by GcMAF. But it is also interesting to notice that this effect of GcMAF on angiogenesis could be exploited in a number of other pathologies where increased or deregulated angiogenesis is part of the pathological process, like neurodegenerative disorders like Parkinson's disease and Alzheimer's disease, rheumatoid arthritis, chronic inflammation regardless of the cause, diabetic retinopathy, and just 1 week ago we learned that also multiple sclerosis is characterized by deregulated angiogenesis, and also multiple sclerosis could be a target of action for GcMAF. But why, having had such interesting effects on GcMAF that had been produced in the laboratory, why did we decide also to explore the possibility of having a food-based macrophage activating factor, something that you could prepare in your own kitchen, as we will try to demonstrate tomorrow at this class in the afternoon. Well, here we see a baby goat drinking milk from her mother, and we were inspired, actually, by the way that nature uses to confer powerful immunity to newborns, to mammal newborns. And we hypothesized that GcMAF could be produced not only in the laboratory, but also in a kitchen, in a fully natural way. Why? Because there are certain strains of bacteria that produce the very same enzymes that are produced by immune cells or can be used in the laboratory. These enzymes are beta-galactosidase and sialidase, and are those enzymes that transform the inert GC protein, the precursor, into the active GcMAF. Therefore, we hypothesized that if we could devise an algorithm that is a sequence of events, we could obtain GcMAF during natural milk fermentation, so that the GC protein that is contained normally in milk or better in colostrum could be transformed into GcMAF. Also, there have been observations that supported this hypothesis of ours. For example, it had been demonstrated that the effects of probiotics in general in preventing colonic tumorigenesis were associated with macrophage stimulation. So we thought we were on the right track. And we thought that if we were able to produce GcMAF in a natural food, and we could drink this food, the GcMAF in this food would activate the macrophages, not only in the wall of the entire gastrointestinal tract, but, as Dr. Margolis said, here, probably the most important and vital part of our body. The Valdayer Pirogov or Pirogov tonsillar ring is where there is the highest concentration of macrophages, and there is a reason for this, because whatever we breathe, whatever we eat, whatever we drink, has to pass there. So this is the first and probably strongest line of defense against the enemy. Then we could talk how this GcMAF and these bacteria and other microorganisms could also survive the acidic stomach environment. In order to demonstrate whether this hypothesis was feasible, we devised an algorithm. An algorithm is a complex word, so a recipe, it's easier, a recipe, a sequence of events, easy but not so trivial, so that we could prepare a product using those milk ferments or milk bacteria that we know express, synthesize, and release the enzymes that are involved in GcMAF synthesis. And then we had to test these and see whether we could observe hematological and immune system changes. This, unfortunately, is not our home kitchen. It's not this big. This is a typical American kitchen. This was downloaded from Wikipedia, so there should be no copyright issue here. But to tell you that we moved from the laboratory to the kitchen. And exactly as we did 3 days ago here in Wichita, all the materials and kitchen tools were purchased at local stores. More difficult was to find fresh, high-quality, pasteurized bovine milk, but it could be found. And maybe all these details will be given in further detail tomorrow. Consumption of this product occurred at the end of a meal as a dessert, a meal rich in vegetable fibers for a number of reasons. And the participants were instructed to wait a few seconds before swallowing the product so that the product could remain in contact with the oral mucosa. The product is very sticky, and also we instructed, some people were laughing when we instructed participants to do this, to gargle or swilling it as if it was a mouthwash, so that the product that is sticky could come in contact with the white surface of the oral and pharyngeal mucosa. And also, dentists might not like this idea, but the participants were instructed to wait at least for 1 hour before brushing their teeth so that it could remain also in close contact to the alveoli. Now, let's see what the results were. subject number 1 is speaking, and is a non-smoking male, 56. And he has multiple thyroid nodules. That's why I don't wear a tie. I know that during a presentation I should wear a tie. I wear a scarf because of these thyroid nodules. So far, no malignant cells over there, but there were signs of moderate immunodeficiency and anemia. And unfortunately, it has been reported, this is known, that anemia is among the predictive elements of malignancy in thyroid nodules. Since I am a radiologist, I perform echography on myself. I don't know how much can you see. Well, that's nice. So this is one nodule on the lower right lobe of my thyroid, 1.17 centimeters. Here is the color Doppler. As usual, you have vascularization, new blood vessels around, as always happens. This is another small one, 0.7 centimeter. Make the translation in inches, but 1 centimeter is this big, you know. This is the vascularization around. Okay, this is the big one, this here, 3 centimeters. 3 centimeters is this size. It almost occupies all the left lobe, so this is the few normal thyroid tissue remaining. All this is the nodule, and if you apply the Doppler, you see deep vascularization, increased vascularization, as it always happens in tumors because of the neoangiogenesis process, and also there are areas that are hyporeflecting, hypoechogenic, as we say, as radiologists, that indicate metabolically inactive tumor. First thing that we looked at were CD4 cells, CD4 lymphocytes. You probably hear about CD4s when you talk about HIV and AIDS, because typically those are decreased in association with HIV infection, and they also define AIDS. AIDS is when they are below a certain threshold. CD4 cells, of course, are considered among the major anti-tumor immune effector cells. Why did we look at CD4 cells since I have thyroid problems but I don't have AIDS? Well, because it had been demonstrated by other researchers who were working on parallel lines. These are Canadian researchers, that when you give a probiotic yogurt similar but not identical to this one, to people living with HIV/AIDS, you observed an increase in CD4 cells, which is something very welcome by these people. So we wanted to check what happened to my CD4 cells, and before consumptions, the value were below the threshold of a normal value, 372 cells per microliter. This finding is not uncommon in a thyroid problem, and it is interpreted considering the complex relationship between thyroid disease and immune system. After 3 weeks of consuming this product, the CD4 rose above the threshold of normal value, 609 cells, and such an increase continued, and after 8 weeks, in about 10 weeks, I beg your pardon, the increase reached the number of 853. Not only that, but also the ratio between T helper, the CD4, T suppressors, the CD8, increased, improved, and the ratio went from 1.8 to 2.2. So this indicates an improvement and a normalization of the immune deficiency. The increase in CD4 cells was also associated with an increase in total T lymphocytes that rose from the value of 681, which is abnormally low, to the normal value of 1,270. Then we looked at natural killer cells, or clone 16, CD16. Why? Because these are cytotoxic lymphocytes, and they constitute probably the major component of the innate immune system, and they play a significant role in the rejection of tumors and cells infected by viruses. Before consumption, the number was 165, still normal but low. In about 10 weeks, the number doubled, 390, almost doubled, 97, thus demonstrating again that there had been a significant stimulation of the entire immune system, not only one type of cell. As I told you, there was a mild anemia. My red blood cells were 4,000,000.55 before consumption. After 3 weeks, the values were normal. Also, the hematocrit and the hemoglobin level normalized, and also the platelets went up from 165 to 200.6,000. Now you may think that there was a non-specific stimulation of my bone marrow function, because so far all the values have gone up, except maybe for the CD8, the T suppressor. This was not the case because the neutrophils decreased from 77% in percentage to 55% in about 10 weeks. And this clearly indicates that there was a normalization of the hematological parameters that are indicative of a pro-inflammatory state. There is no need for me to repeat you how important is the systemic inflammation, not only in cancer, but in a number of chronic diseases, because many speakers today and yesterday have stressed this point. And also the albumin globulin ratio increased from 1.17 to 1.66 in about 10 weeks, and the complement fractions C3 and C4 decreased from 120 to 86, the C3, and from 33 to 19 milligrams per deciliter in 10 weeks. So all these things together, they point to a reduction of the inflammatory state that was present before consumption. So here we clearly have two evidences: stimulation of the immune system, reduction of the inflammation. So let's quit with my situation and let's talk about an Austrian subject who is under supervision of an Austrian doctor in Vienna. This subject is a male, non-smoking, 62, had been operated hemicolectomy for colon cancer with multiple lung metastases. And this subject was undergoing chemotherapy with these so-called new biological drugs during consumption of this product. This is very interesting because now we are looking at CD4 cells in a subject who is undergoing chemotherapy. There is no need for me to remind you that it is well known, chemotherapy in itself, it is immunosuppressant. Everybody knows this and tries to take care of this. Well, in this subject, while undergoing chemotherapy, the CD4 cell count rose from 625 to 829. So not only the CD4 did not decrease, that already would have been an excellent result. They kept on increasing despite the chemotherapy. And also the monocytes, the circulating monocytes, increased from 372 to 432. And this is fully consistent with an old observation, again by Yamamoto and collaborators, published in 1998, where they demonstrated in mice that GcMAF stimulated the proliferation of the precursors of the monocytes. And here in human, we see that this was true and the monocyte rose. The next slide, however, is probably the most important, at least in my opinion, because the carcinoembryonic antigen decreased in this subject from 64 to 5. And we have been we have been hearing this protein, C-reactive protein, many times today and yesterday, a marker of systemic inflammation. C-reactive protein decreased from 5.9 to 2, so less than half. And also this, of course, indicates a normalization of the pro-inflammatory state, something that we are actively pursuing with intravenous vitamin C, with other means, whatever is able to decrease the inflammation in chronic conditions is always welcome. Of course, the fibrinogen followed and also decreased from 424 to 341, and the neutrophils also decreased from 55.8 to 40. But when we were talking about tumors, again, as I tell you, I am a radiologist. All these numbers coming from the laboratory are very interesting, very indicative, but as a radiologist, I want to see the mass, and I want to see the mass decrease. So this impressed me much more. This is just, this is not his actual scan, it's again a picture downloaded from Wikipedia. And I don't have, because of privacy reasons, the actual scans, but I have the reports. They're in German, because of course in Austria they speak German, and I don't want you to read, but there is one word that really strikes, grossen Regredienz. It means reduction of size, reduction of gross means great. So before consumption, he began in October 2011. Before consumption, one of the major metastases was 56 millimeters. Zuletz means before. It was 56 millimeters. Heute, today, 48 millimeters. That makes all in diameter, of course. So we are not talking about volume, we are talking about diameter. So make all your mathematical calculation. And then 3 months later, again, we can read here, heute 46. So we went from 56 to 48 to 46. So we can see a clear reduction in the size of the metastasis. Was this due to the therapy? Was this due to this product? Who knows? And most important, who cares? The point is that all the laboratory parameters were indicating a reduction in the size of the tumors, and the CAT scan confirmed. Not only that, these changes were associated with the almost complete disappearance of the side effects of conventional chemotherapy that the same subject had experienced during previous cycles. It's not that this subject was an extremely strong person who could stand every type of treatment. No, he had undergone 2 previous cycles of chemotherapy, and he had suffered a lot. And we have heard the oncologists say that many, many times people, they even tend to refuse conventional treatment because they're afraid of the side effects that are really terrible in some cases. Well, this time, for this guy, that was the 3rd time, there were no side effects. And this is, if our only result was that one, that would be a wonderful result for us. Because if this procedure, what we call natural food intervention, would be able only to let people tolerate therapies, that in itself would be an incredible good result for us. And we observe this not only in people with cancer undergoing chemotherapy, but also in people with HIV undergoing antiretroviral therapy that, as you know, is not so different than cancer chemotherapy. Also, antiretroviral therapy produces a number of very fastidious, to be good, fastidious side effects. And here in this room, there is a gentleman who has experienced what I'm saying, and at the end of my presentation, if you wish, he could just give a testimonial on how this natural food intervention really eliminated completely all the side effects of such a therapy. Now, are we talking about randomized controlled studies, double-blind studies, thousands of patients? Not at all. Nobody is talking about these things in these 2 days, neither am I. Are we talking about mere anecdotes? Probably yes. But are mere anecdotes something despreciable? Not at all. This is not a paper about biochemistry, molecular biology, or oncology. This is a paper written by somebody who is a scholar of history and philosophy of science. It is called epistemology. And this is very recent, October 2011. And I just read a few sentences. I challenge the deprecation of stories in medicine. And today and yesterday, we reported stories, and I'm reporting stories. Why? Because, as he says, all these stories, whether they come from double-blind studies with thousands of patients or number one observation of only one patient, all these stories become evidence of what works in medicine. So this has not been said by some heretical scientist. This is what has been said by the heirs of Sir Karl Popper, the philosopher of science. So these are anecdotes, but these are stories that become evidence of what works in medicine. So let's look at other stories. As you can see from the German flag, this is an email that I received from a German doctor who is adopting such a procedure of natural food intervention. And he said, we have a patient with complete remission of her liver metastasis after 2.5 months of using, I'm not here advertising or making any commercial, of using this intervention. It is challenging not to be enthusiastic about it. She has not received any chemotherapy in this period. We all know it's anecdotal and multifactorial, but anyhow, there is something going on. And for the oncologist, I think this is important. I don't think you can read this because I can barely read this. This comes from a doctor in Oregon. And he wrote me, on a personal note, my cancer levels, he is talking about thyroid cancer, are at the lowest ever. Yes. Yeah. And my energy level is good. Get around with the dog in every other day. And I am able to tolerate very long hours at the office with an extended consulting push the past 10 months on a project I'm working with somebody. Now, let me go slightly off topic, but I will go back to cancer right away. From cancer to autism, that, as you see, is on the rise. Very, very long letter. I will not read it, because this is from the mother of an autistic child who had been given this natural food intervention by an Austrian doctor. Very, very long, all details, but 2 or 3 things are important here. With his gut improving, the mother is talking about her child, everything started improving. His mood, his awareness, his physical stamina. She doesn't speak English, is not her first language, neither is mine, but I did not edit any of these letters. I left them as they were. He acquired more balance. I actually started doing yoga with him probably. It was not possible before due to the absence of balance. The clarity of his speech improved, and everything improved. So here we have a mother who is very, very happy seeing improvement in her autistic child who had not been able to improve with any other treatment so far. But why did I underline here acquire more balance? You might think this is of little importance in autism and even less in cancer, because at the same time I received another email, also this written in broken English, no, illiterate English, by somebody who comes from Italy and has prostate cancer. And this gentleman wrote, dear mister, attached I've included the latest results of blood tests that I ran. How can see, probably he wanted to say, you can see my condition is good. Since I started taking this product, I improved my overall general health. That's fine. My weight is always around 80 kilos. Maybe he meant it. Regularized blood pressure. I have had pressure fluctuations in the past. Now they're normal. Fine, fine. But this is interesting. I have become more, try to understand. It is difficult for me too. If he had written in Italian, it would have been much better. But I have become more responsive. My movements are faster. My focus has sharpened. I happened to shoot in the air several times objects were falling. He meant that he was able to pick things that were falling, whereas in the past he could not grab things and everything was falling off his hands. Now you may think, what have these things to do with what am I talking? Well, probably the immune system, the inflammation, the brain and the balance, and the gut, they are all correlated. And with this natural food intervention, we probably are targeting all these organs or all these systems at once. This is a nice review that was published in 2010, and its title is Mood and Gut Feelings. Since here I am in the United States, I don't need to explain and translate what gut feeling means. In my language, I have to explain, because we don't have a similar idiomatic wording. It may be that we need to change the focus from the brain and look at the role of the gut in what have traditionally been thought as brain-based disorders. So here they say that psychiatric illnesses, anxiety, autism, chronic fatigue syndrome, a number of neurological disorders might have their root in the gut. And with this natural food intervention, not only we stimulate the immune system, as we have seen, but also we reconstitute the healthy gut microbiota, or microbiome if you prefer, that is the array of bacteria, yeast, virus, fungi, all the microorganisms that compose a virtual organ of about 2 kilos, 4 pounds, I think, more or less, of weight. You know, I speak in kilos in the metric system. Our liver is 1.5 kilos. All the microorganisms in our body is 2 kilos. The intestine is the largest immune organ in our body. This is not New Age. This is not heresy. This is the Human Microbiome Project from the NIH. And probably with this natural food intervention, we are targeting all these aspects at the same time. Systemic inflammation. It has been said before, and we recently published 2 papers, one in molecular diagnosis and therapy, and the other one just a few weeks ago in the American Journal of Immunology. So I think we are talking about respectable journals, where we demonstrated, among others, we're not the first, but we provide some details, that advanced cancer patients have higher C-reactive protein, and that those who have C-reactive protein, high C-reactive protein, they tend to progress more rapidly toward the so-called cancer, anorexia, cachexia syndrome, the last stage of cancer. And in our papers, of course, the main results is not that we found a C-reactive protein. This had been known for years, but the link between the C-reactive protein and the aberrant immune system activity that probably plays a role in triggering a vicious cycle that leads to further tumor growth and metastasis. So this is me. And this is an echo probe. As I told you, I'm a radiologist. And this is me looking at my brain. I knew that I ran this risk. If I looked at my brain, this could have been the image appearing on the screen of the echo. Why am I looking at my brain? Well, first of all, to check whether it is still there, but because we recently developed a technique, a radiological technique, to visualize the temporal cortex of the brain. This had never been done before. We had to play with the instrument to change all the settings, and we were able to publish these results in the journal Medical Hypothesis that has also been mentioned yesterday. So if you look at Medical Hypothesis, the issue of June or July of this year, that is a few weeks ago, you will find some of the pictures that I'm showing today. So the brain was there, and this is reassuring. Not only that, but we could distinguish all the different structures: the meninges, the subarachnoidal space, the cortex. And most important, we could observe the temporal areas that Konstantin von Economo, an anatomist, the name is very German or Austrian, but he was from Italy. But at that time, 150 years ago, northern part of Italy was part of the Austrian Austro-Hungarian Empire, so his name was changed into von Economo. So he had described many years ago these areas in the temporal lobe called TG and TE. And these areas are involved in the control of eye movement and balance. So now balance comes back. Cancer patient, autistic children, in the standing position. They control the social behavior, the mood, and decision making. How many times have we heard mood changes in cancer patients in these 2 days? Many, many times, both from the so-called mainstream oncologists and from the other speakers. So mood is controlled by those areas of the temporal lobe. And of course, it is worth remembering, we all know, that most of these functions are altered to various degrees in cancer patients. So why was I curious to look at my brain and in particular at my temporal cortex? I will show you the next slide, which is zoom in. So this is my bone, temporal squama. These are my meninges. This is a subarachnoidal space, and this is my cortex. I could even distinguish the different neuronal layers. This is neuronal layer number 5. Histology tells us that it is composed by these so-called deep pyramidal cells. I don't know if it is spelled correctly, probably not. And this is neuronal layer number 6, polymorphic cells. Because now I have a tool, cheap, easy, non-invasive, no ionizing radiations. I have a tool to measure the thickness of the cortex, to measure the presence of inflammation. How do I do? I simply switch on the power Doppler or the pulse Doppler, whatever these tricks that we radiologists use, and I can see the vascularization. So now I have a tool. This is work in progress. I have a tool to measure inflammation in the brain, not relying upon laboratory data. Not that I don't trust laboratory data, of course I do, but here I can see my brain or other people's brain. I can measure the thickness, I can measure the inflammation. Therefore, I can monitor the progression of any disease that has underlying systemic inflammation, influencing all these functions that we've been talking about that are altered in chronic conditions from AIDS to cancer to chronic fatigue syndrome. So I have the tool to measure these things objectively, not only to rely upon subjective feelings, which are important, but here I can measure brain inflammation. Please remember that chronic fatigue syndrome is an old definition. Now it is more properly called myalgic encephalomyelitis. Myelitis stands for inflammation. This is a zoom in again, so we can see these are the old pictures of von Economo, and this is what I can see with the eco machine. So now we have a tool to assess whether our intervention, whether they be the natural food intervention, intravenous vitamin C, or whatever else, or GcMAF injected somehow, now we have the tool to visualize whether the chronic inflammation decreases, whether the thickness of the cortex, which is decreased in many chronic conditions, regains its thickness. We're close to the end because we're close to the conclusions, and the conclusions are that food-based macrophage activating factor can actually help cancer patients by modulating, I would say stimulating, the immune system, reducing the side effects of conventional therapies, reducing systemic inflammation, counteracting nutritional deficiencies. And I think we are only at the beginning of the story. Now, before I project the last slide, well, I can do, this is me with my collaborators with a probe in my hand, ready to perform some sonography on somebody. I wish to remind you that at the banquet, you can taste this natural food intervention. Please don't call it yogurt, because yogurt is really diminutive. You know, in a yogurt, at best, you have 6 different strains of microorganisms. Most likely you have 2 or 3. In this one, you have more than 30 that are there in a very precise ratio, one with the other, colony forming units, so it's something slightly more complicated than in yogurt. In any case, my lovely wife spent the last 3 days searching all Wichita stores and preparing it from scratch. But that was a good try, because if we could prepare it here in Wichita, probably we can do this everywhere in the world. What I mean is that since we had never been in Wichita before, and we were able to find everything easily, this means that it can be done easily. So that was not that Wichita, you don't find things in Wichita. So she spent 3 days preparing this product that you will be able to taste, if you wish, of course, as part of a banquet. Should be, or it will be in a short while, on the table at your banquet. And so, before thanking you for your patience and attention, I used the entire hour that was given to me. I wish to ask Mr. Jonathan Barnet, who is the testimonial I was talking about, to tell you his story with this natural food intervention. I really thank you for your patience, and of course I'm available for any question. And again, tomorrow we will have this class or course, call it as you like, and I will provide further information. Thank you very much.
Thank you. I feel like I'm crashing a party here because you all paid good money to hear experts, and I'm merely a patient of the Riordan Clinic and of Dr. Ron. And I can't testify what Marco has asked me without giving you a very, very quick, brief description of my history. I was diagnosed HIV positive in 1998, and I have been on the antiretroviral cocktails, what a name, immediately in 98. It was December of 98. And by New Year's Eve, I was having an affair with the toilet bowl. I was either hugging it or sitting on it. But I put up with them for about 1.5 years until I decided, frankly, that I would rather die. And that sounds kind of extreme and exaggerated. I don't mean for it to. I'm just trying to remember what it was like that many years ago. So I quit them. And I was able to stay off of them for a couple of years. I did go back on them briefly because I was scared of the numbers, and I quit them the second time in 2002, all because of the adverse, I don't call them side effects. There's nothing side about them. They're adverse effects of these drugs. I was able to make it for 10 years with some problems, but actually by 2006, I was on 24 prescription drugs that had nothing to do with HIV. So try to imagine, I couldn't talk, I couldn't walk, I was falling down. Trying to get to the point here, I want you to have some background of where I was coming from. I'm extremely averse to drugs. But working with Dr. Ron and Professor Ruggiero, who I'd known through the internet, I started MAF 314 in the spring of this year, and I think in March. Despite that, my numbers got to a point that was really scary. So I also restarted antiretrovirals. However, I'm not doing the cocktail. I'm not doing what my doctor told me to. I'm doing half dose of a monotherapy of ARV based on some information I'm getting from friends in other countries, not in the United States. Despite that, in the first 30 days after starting, the doctor called to give me the results and said, "I'm impressed. You are being so good." Now, I expected a 1 log decrease, and I got a 2 log decrease. So that's my first testimonial. For whatever reason, despite being on half dose of a single class of antiretrovirals, my viral load dropped 2 logs. My CD4 started going up. But to get back to the point of what Marco wanted me to talk about was, I don't have diarrhea. I don't have nausea. The yogurt actually, I crave it now. If I don't get it at night, I realize I'm missing something. There's one other piece of information I'll share. I'm assuming a lot of people here know about organic acid tests. When I started coming to this clinic 2 years ago, there were 20 markers that I was out of range on. Half a dozen of them were in the bacterial, fungal, and bacterial overgrowth, fungal overgrowth in my gut, things that every other doctor I had seen had overlooked, and 4 neurotransmitter markers were out of range. Dr. Rod and I got those down from 20 to about 12 at the beginning of the year. Since starting in the MAF, I'm now down to only 3 of them being out of range, 1 fungal. All of the and this made me think of this when you were talking about something on one of your slides. All of the neurotransmitter markers are back in range. That's what I have to share. I think that a lot of illnesses are multifactorial, and we have to find multiple ways to address them, and I'm impressed, and it tastes good.